Hi, I'm Dr. George Bakris, Professor of Medicine and Director of the Comprehensive Hypertension Center at the University of Chicago Medicine. I'm a nephrologist and hypertension specialist, and I'm here today to give you tips on hypertension management in high-risk patients as well as the general population. Initial evaluation of a hypertensive patient is very important so you know where you're starting from. On physical exam, the carotids need to be auscultated appropriately and to make sure they don't have any bruits. You need to check peripheral pulses to make sure they don't have any bruits and that there's good strong pulses in the legs. Obviously, blood pressure needs to be checked appropriately with the appropriate size cuff, and it should be done in an appropriate manner. The current guidelines recommend that the patient be sitting in the chair quietly for 5 minutes after they have been hooked up to an automated blood pressure device. And then at that time, the button should be pushed, ideally by the patient, but a nurse can come and do it. And you sequentially repeat this every minute for the next 3 minutes, so you have 3 readings. The first reading is excluded, and you take the next 2 readings. Additionally, only on the first visit, you should check the blood pressure in the contralateral arm to make sure that it is similar, and it should be within 8 to 10 millimeters systolic of the contralateral arm. If you have all of these, then you have very good reliability as to the vascular status of the patient, assuming that you've also listened to the heart and the lungs, and ideally, although I know it's not done much anymore, an ophthalmoscopic exam of the eye should be looked at for grade 2 and grade 1 retinopathy to examine long-standing hypertension. These are really critical issues so that you can educate the patient on what their current status is. And additionally, lab work for kidney function, lab work for CBC, and many of you, although it's not routine practice, get echocardiograms. Electrocardiograms are mandated and should be looked at. And so these are really the important issues that you need when you're first evaluating these patients. So you can see the kidney function, cardiac function, and vascular function of the patient. I hope you've enjoyed this tip, and hopefully you can use it in your practice to improve patient care. Thank you and have a good day.